1 in 4 women and 1 in 13 men are victims of domestic violence in their lifetime. 24 people per minute are victims of physical violence, rape, or stalking by an intimate partner. Domestic violence affects people from all walks of life, all ages, races, ethnicities, religions, educational backgrounds, and income levels. What does this mean for you as a healthcare professional? A new study shows that 3 in 4 domestic violence victims go unidentified in emergency rooms. Nearly 80% of female victims of intimate partner violence visit emergency departments for medical complaints. As many as 72% are not identified as victims of abuse.
We see those patients, they come here for care, they come here for their primary care, they come here when they're sick or injured, and so we're going to see a lot of them. And we're going to be their portal into the health system, and so we're the first line to find them and identify them.
The purpose of this video is to achieve a few goals. First, to help you as a medical professional know how to understand and identify domestic abuse as it may present itself in your daily work routine. Second, empower you to respond effectively to the victim's needs and be able to offer options that could include contacting Safe Harbor. Who is Safe Harbor? Safe Harbor is exactly as it sounds, a safe place for victims of domestic violence and their children to start a new life. We will share more details about Safe Harbor and their services later in this video. The most important thing that we hope you take away from this video: learn the warning signs and be able to talk with your patients in a safe manner. The patient's physical and emotional safety comes first. So here's what we're going to cover in this video. First, we're going to talk about the facts as it surrounds domestic violence. Second, we're going to talk about screening and appropriate responses. Third, we're going to talk about Safe Harbor's mission and services. What is domestic violence? Here are 3 bullet points. First, domestic violence is a pattern of abusive behaviors that is assaultive and coercive. Second, domestic violence involves physical, sexual, and psychological abuse, as well as economic coercion. Third, domestic violence is directed by adults or adolescents towards their intimate partners.
Domestic violence is all about power and control. It doesn't have to be physical violence, which is a common misconception in the community and across the country, that it has to be a physical bruise or a bone that's broken. It can be verbal abuse, psychological abuse, sexual abuse, emotional, financial, anything involving power and control from one person to another.
Now that we are beginning to understand more and more about domestic violence, let's transition to the conversation of how to screen and respond to patients that might be dealing with this issue. Specifically, let's talk about the signs and red flags that a patient might be experiencing. The patient has injuries that indicate the possibility of physical abuse, which could include finger-shaped marks on neck or arms, scratch marks, bruises on face, and bite marks. Also, a patient that is pregnant might also have abdominal injuries or bruises. The patient may seem nervous or anxious when asked to answer questions in front of their partner or spouse. The partner or spouse of the patient might try to answer for the patient rather than allowing them to speak for themselves. The patient acts submissive and obedient to his or her partner or spouse. The patient's explanation of injury does not match up with the injury itself. An example could be the patient says they hurt their arm by falling down the stairs, but you notice hand-shaped bruises on their arm, indicating that someone grabbed them. Another thing to consider: the patient might have injuries that are not readily apparent. These injuries could be easily covered by clothing or garments.
You know, I think that there is an intuition in all of us that something's not right. I think the thing that stands out to me in my particular experience is that conversationally I was not the same with my spouse in the room as I was with my spouse outside the room. I think it's recognizing those small changes in a person's behavior, depending on who might or might not be around.
The first part of this video has been focused on educating you, the healthcare professional, about domestic violence. Now, we want to focus on how you can be a part of the solution. Before responding to the patient, make sure that you are aware of your hospital or healthcare center protocol when responding to domestic violence. So let's begin with how to respond to someone who is displaying warning signs of abuse. First, and most importantly, find a way to speak to the victim in private. Often, the abuser might accompany the victim to the ED or hospital. Try to find a way to speak to the victim alone. You, as a healthcare professional, can ask any family members or visitors to step outside of the room in order for you to have a private conversation about their medical situation. Develop trust and rapport. Use sincerity, tact, and acceptance when talking to the patient. Remember, the more comfortable and calm you are asking questions, the more comfortable the patient will be in answering them. Normalize the situation by saying that many patients experience abuse in their relationships, and it is now protocol to screen all patients for abuse. If the patient reveals that he or she is being abused by his or her spouse or partner, start by clarifying the problems and concerns. Use feedback to make sure that you understand what they are telling you. If multiple concerns exist, help the patient to set priorities. Be careful not to impose what you think the problems are. You can advocate that no one deserves to be abused, but you must also accept the fact that he or she may not be ready to leave the relationship or to seek help. However, it is appropriate for you to respectfully share your concerns as a healthcare provider. Finally, discuss options. Share ideas and options with the patient and explore the pros and cons of each idea. At this time, you can make a referral to Safe Harbor. Explain the basic services provided by Safe Harbor. Empower the patient to make a decision that they are comfortable with at that time.
Safe Harbor provides counseling and shelter for victims of domestic violence, whether they need an immediate place to stay or if they have gotten out of the relationship or have a safe place to go. All of our services are provided for free. In addition to the counseling and the shelter, we also provide orders of protection, which would help a victim be able to stay safe from their abuser.
Safe Harbor serves a 4-county region in the upstate of South Carolina, including Greenville, Anderson, Oconee, and Pickens counties. First and foremost, we have a crisis line available 24/7. Here's our phone number: 1-800-291-2139. This number is safe and confidential and is our first point of contact with those whom we serve. We also have safe, confidential emergency shelters for victims of domestic violence and their children. You do not have to be a resident of a Safe Harbor shelter to receive service. We offer free and confidential counseling and case management for both shelter residents and non-residents. In Greenville County, we also have a legal advocate who assists victims with obtaining an order of protection. If you are interested in educating other groups about domestic violence, we offer education and outreach services to empower our community. Here's the best part: all of our services are free of charge. If you want to learn more about Safe Harbor or need brochures or material concerning Safe Harbor, go to safeharborsc.org/nurse-education. Finally, please remember one last point. Our crisis phone number is 1-800-291-2139. We are here 24/7 to help.